2021 open enrollment period begins Monday, March 22nd and ends Friday, April 2nd, 2021. This is the time for you to review your benefit elections and make changes as necessary. Open enrollment is all about giving you easy access to the benefits that help you live better every day. Explore your options for enrollment, election updates, beneficiaries, and more. In this presentation, I'll go over the open enrollment basics. During this time, you can add, drop, or change coverage from medical, dental, and vision plans and the Healthcare Flexible Spending Account, or HFSA. The changes you make will be effective on May 1st, 2021. If no changes are necessary, your current benefits will remain in effect for the new plan year, with the exception of the Healthcare Flexible Spending Account. You must re-enroll in the HFSA each year. If you add any new dependents during open enrollment, supporting documents must be received by March 31st, 2021, or coverage will not be added. So what's new this year? Medical plan rates have increased in all plans. There is a new $75 spousal surcharge for those who choose a plan that includes spousal coverage. The maximum out-of-pocket is increased to Patient Protection and Affordable Care Act annual limits. The new dental provider is Cigna, with new rates and some enhanced benefits. The new flexible spending account provider is Total Administrative Services Corporation, or TASC. And group accident insurance has been added to the supplemental plan options. As employees, you will enroll using the Employee Self-Service Portal at portal.houstontx.gov. If you need to reset your ESS password, contact HITS at 832-393-4487 or houstontx.service-now.com. Your eligible dependents include a legal spouse, natural, adopted, or stepchildren up to age 26, children up to age 26 over whom you have legal guardianship or legal foster care, grandchildren up to age 26 if they qualify as your dependents for federal income tax purposes and live with you. Ex-spouses are not considered eligible dependents unless a court order has been issued that states they need to be covered on your health plans. Step-grandchildren are not considered eligible for benefits under any circumstance. Other eligible dependents include disabled dependents over age 26. In order to qualify, the dependent must depend on you for more than 50% of financial support, must be classified as disabled and covered on a medical plan before reaching age 26, and approved for coverage after age 26. If you have a dependent for whom a court order has been issued requiring you to provide healthcare coverage, you must provide Benefits Division the court order within 31 days of the event. In all situations, the plan's eligibility rules and necessary documentation apply. The city requires proof of identity such as Social Security numbers or TIN, and proof of eligibility such as a birth certificate, marriage certificate, or legal adoption paperwork. Please be advised that you will also need to provide all the dependents' Social Security numbers and dates of birth to enroll. The list of required documents is available on the Benefits Division website. If you are adding a dependent, you must submit your supporting documents by March 31st, 2021. You can submit supporting documents through the Secure Document Submission Portal at bit.ly/COH benefits form. Or you can bring them in person to the 611 Walker 4th floor lobby drop box. If both you and your spouse work for the city, you may be covered as an employee or as a dependent, but not both. Dependents may be enrolled under only one parent or guardian if both parents work for the City of Houston. Outside of open enrollment, the only other time you can make a change is if you experience a qualifying life event. A qualifying life event is a change in your situation that makes you eligible to enroll or change your health benefits. Some of the most common events are marriage, birth or adoption of a child, divorce, loss of other coverage, and moving outside the coverage area. You are responsible for notifying the Benefits Division of a qualifying life event within 31 days of occurrence. If you wait until after 31 days, you lose the ability to enroll or make changes until the next open enrollment. The City of Houston offers 3 Cigna medical plans: a consumer-driven health plan, or CDHP, a limited network plan, similar to an HMO, and an open access plan, or OAP. Let's talk about how these plans differ. The CDHP offers a low paycheck contribution and includes a health reimbursement account to help you lower the cost for services. The city pays for the first $500 for an individual or $1,000 for family from the health reimbursement account, which can be used to offset your deductible or coinsurance costs. Under the CDHP, you have access to all Cigna providers throughout the country without having to seek referrals to see specialists. There are no copays on this plan, meaning that you will pay 20% of the cost of your doctor visits, hospital stays, lab works, x-rays, emergency room visits, and outpatient procedures when you stay in network after you reach your annual deductible. The annual deductible on this plan is $1,750 for an individual and $3,500 for family coverage. Remember that these deductibles are offset by the HRA. This plan includes a 4-tier prescription drug plan, which also utilizes the 20% coinsurance. Please take a moment to review the biweekly rates on the screen. These include discounts for non-tobacco users and participation in the annual wellness program. The limited network plan allows you to choose from 3 provider groups: Kelsey-Seybold, Renaissance, and Village Family Practice. This means that you will need to coordinate your care within these networks. In the limited network plan, you have a lower deductible and pay less for services. The limited plan has a $200 annual deductible for individuals and a $600 annual deductible for family. Additionally, you have set co-pays for things like primary care visits, specialists, outpatient surgery, inpatient facilities, ER, and urgent care. The limited network plan does not offer a health reimbursement account, so the city is not contributing toward the cost of services like the CDHP. If you choose to enroll in the Village Family Practice or Renaissance Network, you must choose a primary care physician. If you choose to enroll in the Village Family Practice or Renaissance Network, you must choose a primary care physician, and you will need a referral from your PCP in order to see a specialist. At the time of enrollment, a PCP will be assigned to you based on your zip code. When you receive your insurance card in the mail, please contact Cigna directly to update to a provider of your choice. If you choose to enroll in the Kelsey-Seybold network, you do not need to choose a PCP. With Kelsey-Seybold, you can visit any Kelsey-Seybold office in the Houston area, and you do not need a referral to see a specialist within Kelsey. Please take a moment to review the biweekly rates on the screen. These include discounts for non-tobacco users and participation in the annual wellness program. The Open Access Plan, or OAP, is the most expensive plan in terms of paycheck amounts. However, it gives you greater flexibility to choose your care than the other 2 plans. The OAP gives you access to Cigna's national network without a need for referrals to see specialists. The OAP has an annual deductible of $850 for an individual and $1,700 for a family. Once you have met this annual deductible, you will pay 30% coinsurance for most services until you reach your maximum out-of-pocket. You have a set copay for primary care and specialist visits. The OAP includes a 4-tier prescription plan with no deductible to meet. The 3 medical plans have differing copayments and coinsurance amounts for your prescription coverage. The CDHP has a prescription deductible that is combined with your medical deductible of $1,750 for an individual and $3,500 for a family. On the CDHP, all drug tiers will require you to pay 20% of the cost of the drug. The limited plan has a separate deductible from the medical deductible, so this is an additional amount you will pay exclusively for prescriptions. The limited plan offers tiered copay amounts for different classifications. The OAP does not have a prescription deductible at all and offers a tiered copay and coinsurance amount for different drug classifications. Please review the cost of prescription drugs by verifying which tier your prescriptions fall under and carefully considering your options when choosing your medical plan. 90-day prescriptions have a higher copay or coinsurance than 30-day prescriptions. Specialty drugs in the limited network and open access plans are only available as 30-day prescriptions. You can save money on your 90-day prescriptions by choosing Cigna Express Scripts. You'll pay just 2.5 times your retail copay for a 90-day prescription. There are over 68,000 retail pharmacies in your network, which include local pharmacies, grocery stores, retail chains, and wholesale warehouse stores, all places where you may already shop. 30-day prescriptions can be filled at any retail pharmacy in the plan's network, including CVS, H-E-B, Kelsey, Kroger, Walmart, and Walgreens. For 90-day prescriptions, you have the option to use a 90-day retail pharmacy in the plan's network, including CVS, Target, Kroger, Walmart, or you can use Cigna Express Scripts. Visit mycigna.com for a complete list of in-network pharmacies. Pharmacies in which you can fill a 90-day prescription will be identified with a 90 symbol. Cigna has partnered with Cigna Express Scripts to offer savings on many generic and name brand drugs through mail order. Signing up for Cigna Express Scripts is easy and convenient, with your prescriptions shipping to your home for free. Covered medications include generic and brand name asthma medications, generic cardiovascular and high blood pressure medications, generic cholesterol medications, generic diabetes medications, preferred brand diabetic test strips, and brand name insulin. Additionally, if you are a member that is not enrolled in Medicare, you are eligible for free diabetic glucose meters. Call Cigna Express Scripts at 1-800-835-3784 to get started. Cigna is your new dental carrier. The City of Houston is excited to offer 2 new dental plans for eligible employees and retirees. You have the option to choose between the Cigna Dental Care DHMO plan or the Total Cigna DPPO plan. The Cigna Dental Care DHMO is a cost-effective plan that has fixed copays for dental services, with no deductible or annual maximum on services. You will need to select a primary care dentist and will need a referral to see specialists. The service area includes all of the United States, except for 13. Benefits start on May 1st. There is no waiting period. You will not have to submit claim forms on this plan unless you choose services that are out of the network. There is no charge for preventive services on this plan and fixed copays for basic and major services. If you enroll in this plan, Cigna Dental will automatically assign a primary care dentist based on your zip code. Once you receive your dental ID card, you may contact Cigna Dental to change to an approved provider of your choice. For more plan information, refer to cityofhoustonbenefits.org. The Total Cigna DPPO plan gives you the freedom to visit any licensed dentist or specialist. No specialty referrals required. The plan will cover eligible dental expenses after you satisfy any applicable waiting periods and meet any deductibles. The annual deductible is $50 per individual and $150 per family. The annual maximum benefit for Class 1, 2, and 3 expenses is $2,000. The plan is based on co-insurance levels that determine the percentage of costs covered by the plan for different types of services. For example, Class 1 expenses are preventive services like cleanings and certain x-rays and are covered at 100% by the plan. Class 2 expenses are basic services like extractions and root canals and are covered by the plan at 80%. And Class 3 expenses are major services like bridge work and crowns and are covered at 50%. To find out if your dentist is on a Cigna plan, go to Cigna.com. Choose the Find a Doctor, Dentist, or Facility tab. Under How Are You Covered, select Employer or School. Then select Doctor by type. Enter the address, city, or zip code. Select General Dentist from the drop-down. Under Please Select a Plan, enter address, city, or zip after I live in and choose to continue. Select either Cigna Dental Care Access or Total Cigna DPPO, depending on which plan you are interested in. Review a list of dentists in the city that you typed in. If you need help choosing a dental plan, contact the pre-enrollment helpline at 1-800-401-4041. If your dentist is not in the Cigna network, you can submit a dental provider nomination form for contracting outreach. Forms are available at cityofhoustonbenefits.org, or you can request one from the Cigna pre-enrollment helpline at 1-800-401-4041. Did you know that eye health is an important component of your overall health? Eye exams can detect many chronic issues, including hypertension, autoimmune disorders, cancer, and thyroid disease. With the Vision Plan, there are no annual deductibles, just simple copays when you use the services. You will pay $20 for your annual routine eye exam and $25 for your glasses or contacts. The $25 eyewear benefit includes a $150 allowance toward your glasses or contacts, including single vision, bifocal, trifocal, lenticular, progressives, high index, and polycarbonate lenses. Additionally, if you are thinking about laser eye surgery, the Vision Plan offers a one-time $300 credit toward LASIK. Superior Vision offers many providers to visit for your eye care needs, including EyeMasters, VisionWorks, Target, Sam's Club, Today's Vision, Walmart, Vision Source, and many others. To see a complete list of providers in the network, visit superiorvision.com. The City of Houston offers two options for flexible spending accounts: the Healthcare Flexible Spending Account, or HFSA, for health-related expenses, and the Dependent Care Reimbursement Plan, or DCRP, for dependent care expenses. There is a new provider for the 2021 plan year, Total Administrative Services Corporation, or TASC. During open enrollment, you can sign up for a Healthcare Flexible Spending Account, while dependent care reimbursement sign-up starts in November. The plan year for HFSA is May through April, and the DCRP is January through December. The Healthcare Flexible Spending Account allows you to stretch your budget further. The HFSA is a voluntary pre-tax benefit plan that allows you to set aside money from your paycheck to be used to pay the out-of-pocket medical, prescription, dental, and vision expenses that you or your eligible dependents incur. You never pay taxes on the money you put into your account, giving you more bang for your buck when you use pre-tax money to reimburse qualified healthcare expenses. So how does the HFSA work? First, you'll select an annual amount to contribute. This will be divided among 24 pay periods. The minimum annual amount you can contribute is $240 and the maximum is $2,550. There is a $500 rollover into the 2022 plan year, but any amount over that will be forfeited. After you enroll, you will receive a TASC MasterCard in the mail. Use it like a debit card at your doctor's office, pharmacy, and more to pay for qualified expenses. You have 90 days after the plan year ends on April 30th to file claims with TASC for any expenses that you weren't able to use the TASC MasterCard to pay for. In addition to copays, coinsurance, and deductibles for medical, dental, and vision services, you can also use your HFSA for chiropractor visits, to pay for eyeglasses, contact lenses, LASIK surgery, bandages, first aid kits, hearing aids, medical equipment, lab fees, diagnostic services, and hospital services and fees. For more information about the HFSA, visit cityofhoustonbenefits.org. The City of Houston provides a basic life insurance policy for each eligible employee that is equal to your base annual salary at no cost to you. You do not need to do anything to qualify for the basic life insurance policy. It is automatically provided by the city. Your spouse is eligible for a $2,000 basic life insurance benefit and your dependent children for $1,000 after you enroll them in coverage using ESS. You have the option to purchase voluntary life insurance for yourself up to 4 times your annual base salary. If you are a new employee, you must enroll within 30 days of your hire date and are guaranteed issued up to 3 times your annual base salary. Guaranteed issue means that you do not have to answer any medical questions or submit an evidence of insurability form to get the coverage. If you are electing 4 times your base salary, you need to submit an evidence of insurability form to Dearborn for approval. You may also purchase additional life insurance on your dependents. Your spouse can carry up to half your annual salary up to $50,000. Additionally, you can cover your children for $10,000. Premiums are calculated based on age, salary, and coverage amount chosen, so you can review the rates when you log into ESS to select your benefits. The voluntary life insurance is a post-tax benefit, which means you can elect increase, decrease, or cancel your coverage at any time. However, if you are electing or increasing your life insurance coverage after your first 30 days of hire, you will need to submit an evidence of insurability to Dearborn for approval. Life insurance is not always so simple. Life insurance benefits cannot be paid to anyone under the age of 18 without legal financial guardianship documents on file with the courts. If you are interested in naming someone under the age of 18 as your beneficiary, you must have proper legal documents drafted that allows them access to the money. Otherwise, the funds will go into a trust until they have reached age 18. If you experience any major life changes, such as divorce, marriage, birth of a child, death of a loved one, we strongly encourage you to update your beneficiaries with the benefits division. You can update your beneficiaries at any time. When you list your beneficiaries, remember that primary beneficiaries are those who will absolutely receive the amount listed. Contingent beneficiaries will only receive life insurance funds if the primary beneficiary has also passed away. If you have elected life insurance for your dependents, you are the only beneficiary on those plans. The City of Houston's supplemental insurance offerings are provided by Continental American Insurance Company and include group hospital indemnity, group critical illness with cancer, and group accident insurance. They will help protect you and your family against unexpected costs due to medical conditions and hospitalization. Individual and family supplemental coverage may be a good fit for some employees who want extra financial protection. The Group Critical Illness Plan pays a lump sum benefit if you are diagnosed with a major occurrence, including cancer. You can receive up to a $20,000 lump sum payment paid directly to you upon diagnosis of cancer, heart attack, stroke, coma, major organ transplant, kidney failure, burns, and more. Additionally, you can receive lump sum for reoccurrence benefits so long as they are 6 or 12 months from the original occurrence. This is not an exhaustive list of all the covered occurrences, and some exclusions or limitations can apply. For more information, visit cityofhoustonbenefits.org. The Hospital Indemnity Plan helps cover the costs associated with hospital visits and surgical procedures. This plan reimburses you after you file a claim, which can help lower the out-of-pocket expenses associated with an unexpected medical condition or hospitalization. Some of the benefits include a $100 per day for ICU stay, up to 30 days, a one-time hospital admission benefit of $500, a $150 a day for hospital room confinement up to 30 days, a $125 benefit for outpatient surgery, and a $50 benefit for health screenings. This is not an all-inclusive list, and some exclusions or limitations can apply. More information can be found at cityofhoustonbenefits.org. Group accident insurance covers the cost of expenses due to an accident, such as ambulance rides, emergency room visits, surgery, and anesthesia, prescriptions, major diagnostic testing, and burns. Benefits are paid directly to you unless otherwise assigned. Coverage is guaranteed issue, which means you may qualify for coverage without having to answer health questions. Benefits are paid regardless of any other medical insurance. The supplemental plans are not eligible for enrollment through ESS. To enroll, you must either call Continental American Insurance Company at the numbers listed above or visit their website at wecareworks.com/wecare. Employees, covered spouses, and retirees enrolled in the Cigna medical plan are eligible to participate in the wellness program and earn a medical rate discount for their 2022-2023 medical benefits. You can earn this wellness discount in 3 easy steps. First, get an annual exam. Visit your physician for your annual physical exam by January 31st, 2022 to earn 10%. Obtain your biometric measurements from your annual preventive exam. These must be labs obtained from February 1st, 2021 or later. You need up-to-date measurements for your blood pressure, total and HDL cholesterol, height, weight, and waist circumference. Step 2. Complete the health assessment. Use your up-to-date measurements to complete the online health assessment at mycigna.com between May 1st, 2021 and March 11th, 2022 to earn 10%. The final step is the wellness engagement. Complete one of 5 wellness engagement options between March 15th, 2021 and March 11th, 2022 to earn 80%. Complete all 3 steps to earn your discount. Earn 100% credit by completing all 3 steps. For more information, visit HoustonWellnessConnection.org. The City of Houston's EAP offers confidential counseling that helps address stress, relationship, and other personal issues you or your family may face. Our team is staffed with qualified clinicians who will listen to your concerns and can refer you to in-person counseling and other resources to help with anxiety, depression, marital conflicts, problems with family, job pressures, grief and loss, and substance abuse. Additionally, EAP offers several educational seminars throughout the year, including anger management, stress management, and more. Through Guidance Resources, EAP can assist with financial information and resources by providing CPAs and financial planners who can assist with tax questions, retirement planning, and getting out of debt. They also offer legal resources, providing you with a qualified attorney in your area for a 30-minute consultation and reduced legal fee rate. If you have a problem, even if you think it's not a covered service, try contacting Guidance Resources. You can contact the City of Houston EAP at 832-393-6510 or Guidance Resources at 855-378-7485. You can also email EAP or visit the Guidance Resources website for more information. The death termination pay form is separate from life insurance. This form allows you to select a beneficiary that will receive any pay which you would have otherwise received, like wages, vacation accruals, sick time, and PTO, that is owed upon your death as an active employee. Make sure that you do not confuse the two forms. The death termination form is your pay, and life insurance is a separate benefit. You must complete this form. Please note that it must also be notarized. You can visit a notary public that is convenient to you, or the Benefits Division has several notaries available at 611 Walker on the 4th floor. If you ever need to reach the Benefits Division, we are conveniently located on the 4th floor of 611 Walker. You can also reach us by emailing benefits@houstontx.gov or calling 832-393-6000. You can also view more information on our website, cityofhoustonbenefits.org.